Thank you, Marley. Welcome everyone to the Back to School Conversation with Dr. Ann Dewan. I'm Maria Dane, Executive Director for Parents Helping Parents. We're a parent training and information center that supports parents who are raising children with special needs to build bright futures for their kids. These are truly challenging times for all of us, whether we're parents or teachers or administrators. So really glad that you all had the time to join us today for this really important conversation. I'd like to introduce you to today's speaker, Dr. Ann Dewan. We approached Dr. Dewan a couple of months ago and said, would you be willing to come and do a back to school conversation? And she immediately said yes with no hesitation. We really appreciate that Dr. Dewan has always endeavored to keep open communications between Santa Clara County Office of Ed staff and Parents Helping Parents staff. Dr. Dewan is the Santa Clara County Superintendent of Schools, a role she assumed in February 2018. She has over 30 years of experience in education, including experience in early learning, special education, education reform, and change leadership. Welcome, Dr. Dewan.
Good afternoon. Thank you so much for having me. It really is a pleasure to make time to be with all of you today. And I want to share some information that will be specific to COVID-19 and some of the things that we might all need to be thinking about as we prepare for the next school year. So first, I thought it might be helpful if I just shared what is a County Office of Education. So County Offices of Education are somewhat unique to California. They serve as an intermediate public service agency between the California Department of Education and our local school districts. The County Office of Education has a lot of responsibilities for oversight and monitoring of schools, but we also have some limitations in terms of the role that we play in supervising schools. So for example, we do have oversight and responsibility for local school districts' budgets. We review and approve those. But we do not have responsibility for the hiring of any local staff. We don't evaluate local school districts, and we also are not the entity in charge of special education in the local school districts. Something that's also somewhat unique to Santa Clara County is that as a County Office of Education, we ourselves are also a provider of special education services direct to students and their families in partnership with our local school districts. Today, I'm really pleased to be with you to share information about COVID-19 and its impact on our schools and what you all might expect in the coming school year. So to get us started, I thought it might be helpful just to clarify what is COVID-19 and why would a County Office of Education care about it or be engaged in it, since it is a health-related item. Well, COVID-19 is a serious virus. It is a novel virus in that it's new. It's not previously been identified and to our knowledge did not exist before 2019. And while it has some similarities like other diseases, it is very unique. COVID literally stands for a couple of the initials from some of the words that make it up. So CO stands for corona, VI for virus, and D for disease, and 19 stands for the year that it was identified. There are many ways that we can protect ourselves from COVID-19. The most important thing we can know is how it spreads so that we can protect ourselves. Also, frequent hand washing, avoiding close contact, and covering our mouth and noses with a cloth face covering when we're around others are protective factors. Some of the things that protect us from other diseases also protect us from COVID-19, such as covering our coughs and sneezes, having regular disinfecting and cleaning, especially those high-touch surfaces, and being on the lookout for symptoms, so constantly monitoring our own symptoms as well as those of our children so that we can take necessary steps early. COVID-19 has significantly disrupted our lives, and as you know, was the reason that schools closed back in March. And one of the things that we do to help us understand the impact of COVID is to monitor the data in partnership with our local public health department. Santa Clara County posts daily a snapshot or a dashboard of the data of how COVID is presenting in our county. And that information is shared by both cumulative as well as new information and is broken down in different groups. And this is easily accessible on the Public Health Department website. Because of this data and the changing conditions around COVID-19, on Friday, Governor Newsom made an announcement to help inform and guide schools as to how they should operate in the fall. One of the mandates that he issued on Friday was that any county that is on the state's COVID-19 watch list could only reopen schools with distance learning in the fall. Santa Clara County is on the state's COVID-19 watch list. We just recently were added back on the watch list. And as a result, all of the schools in Santa Clara County, public, private, and otherwise, may only offer distance learning this fall. We will need to stay in distance learning until we have been off the state's watch list for 14 days. There are many ways that schools and parents and others can stay informed, and Public Health Department does offer every week, Facebook Live sessions on a variety of different topics, Monday, Wednesdays, and Fridays at 10 a.m., and they are available in multiple languages. And there's also a variety of resources available at the 211 number. And you can also find out about how and to get tested and where to get tested at the sccfreetest.org website. And the Public Health Department also has a Facebook page. You might be wondering, why am I sharing so much information from the Public Health Department? Well, the main reason is that as the County Office of Education, we work in tight collaboration and partnership with the Public Health Department, because there is a tight intersection between health and schools, health and education. And we must be working together and collaboratively in order to safely operate school programs. Just lastly, here are some additional resources available from the Public Health Department. They do public health dispatches, newsletters, they provide healthcare services, and regular updates on COVID-19. One of the things that you can expect when we are able to provide any level of in-person instruction will be the use of face coverings. The state of California has a mandate for face coverings that is described in the California Department of Public Health guidance documents. We must wear face coverings when we are in public spaces and also when we are in indoor public spaces. And there are a few exemptions that I'll share later, but mostly I wanted to point out some resources that are helpful for parents and families to use to talk about the use of face coverings and how to help our children adapt, especially when perhaps they are encountering new people for the first time, like perhaps their teacher for the first time. And so how to help your child wear a face mask talks about the use of practicing and getting creative, using familiar clothing, and making sure that the toys and animals and other things that our children play with also have face coverings to wear, so they become familiar with it in all environments. The exemptions are for children age 2 or younger, and also individuals with a health condition or disability that prevent them from wearing a mask. And it's very possible, for example, that some of our students and some of the students in our families will have conditions that would prevent them from wearing a mask safely, or for whom a mask may be too irritating or could be a trigger for other behaviors. And additionally, there is an exemption for persons who are hearing impaired or those who are communicating with the person who is hearing impaired for obvious reasons that they would need to be able to see each other's mouths for that communication to occur properly. And in that situation, we do encourage the use of face shields. Another thing you can expect when we're providing in-person instruction is that all staff will be wearing face coverings unless they have an exemption for medical. And children in 3rd grade and older will also be required to wear a face covering at all times. Children between the ages of 2 years old and up through 2nd grade will have certain times of the day when they'll be required to wear a face covering, and at other times, such as when they're with their stable cohort, face coverings will be strongly encouraged, and they'll be wearing them more frequently than they will not be wearing them. You might be wondering why face coverings are such an important component to the offering of in-person instruction and the operations of school. And the main reason is that face coverings protect both the wearer and others, and they are only effective when we wear them properly. And so part of the role of schools will also be to educate children and families and employees about the proper use of face coverings and how to wear them safely and properly. As we were preparing for the openings of schools this fall, we looked at a variety of possibilities, knowing that COVID-19 conditions might change on a frequent basis. So in our planning considerations, we engaged in planning for in-person instruction, we engaged in planning for distance learning, and also for hybrid models. And as I mentioned before, given that we are a county on the watch list, we will be opening schools this fall in distance learning. The principles that really guide our planning are around the safety and health of students, staff, and families, and that is our main priority. And also all of the priorities around ensuring equity, access, and inclusion, addressing our learning loss that we know many children have experienced, while we're continuing to increase the quality of the teaching and learning across all environments, including the distance learning environment. Our office provides a variety of resources and supports. We really stepped up in these offerings this past spring during the shelter-in-place time. Through our warm line, parents and educators can contact via a phone for assistance in multiple languages, to get assistance in navigating special education in their local school district, as well as getting some support for trainings and materials and learning resources at home, including access to information about digital inclusion. The warm line offers opportunities to answer questions and address concerns both individually, and can assist in making referrals back to school districts and other agencies. And they can also help provide individualized supports for families, such as social stories and assistance addressing the individual needs of a child's IEP. And just quickly, the languages that are available are Spanish, Vietnamese, Mandarin, Korean, and English. Additionally, on our website, we provide learning resources during COVID-19 through our learning resource portal. And you'll note that on that website, there are a number of resources available for parents and also for community, in addition to the Inclusion Collaborative and inclusion supports. And through our County Office of Education, you can stay connected with us. We do update our website regularly, as well as provide parent trainings, resources for school districts and others, and you can find those resources on our website. And so that really concludes my introduction for today. And what I hope to do for the rest of our time together is address the questions that were presented and see how we can support each other as we think about school opening this fall and distance learning.
Hi, good afternoon, everyone, and thank you, Dr. Dewan, for joining us today. My name is Rosa, and I am part of the education group at PHP. I am also a parent of a child with special needs and learning differences. And I know our families are eager to hear what the plans will be, look like and be for when we reopen the schools. So Dr. Dewan, are you ready to get started?
Yes, I am.
Okay. Question number one, what will Santa Clara County schools look like for students in special education in the fall?
This fall, the majority of the time, and we anticipate that schools will be offering distance learning. And for students with disabilities, that will mean that the provision of their special education services will also be provided virtually. That may include access online. There is a requirement in the state distance learning laws that were just passed in June that require daily live interaction via distance learning. And additionally, it could include telecounseling, telehealth resources, and teleservices, as well as the provision of some supports, learning kits, and hands-on materials that schools may provide to families.
Wonderful. Thank you. Question number two, how should new needs that have appeared during the shelter in place, like mental health, behaviors, academic, social, and functional needs need to be addressed?
I think it's really important to recognize that there are a number of new needs that will have emerged, as well as this reality of learning loss that we're hearing from a lot of parents and observing. I think the first thing to do would be to contact your school, your local school principal, and make them aware of the new needs that have emerged and request assistance with referrals, maybe additional assessments that may need to be provided, etc. And I would also really encourage some connection to your child's pediatricians. The pediatricians are in a really good place to be able to also assist with referral and make recommendations to address some of these new needs that have been emerging. For example, we recognize that some of our children are experiencing some trauma and anxiety, and our pediatricians can assist us with that. And then I also think it's really important to stay connected to Parents Helping Parents and maybe some additional parent groups and support groups to help meet the social needs that we have, all of us have as parents, but also to help engage our children with other children as well.
That's wonderful, thank you. If a child is medically fragile, immunocompromised, and or in a vulnerable category, what options will they have when school reopens? Would they be allowed to continue to do distant learning?
Yes, whether we're providing in-person instruction or not, any child that's in the condition or has any of the conditions that you described would be eligible for distance learning under California law.
Great. And this next question kind of ties somewhat into the last question. If a family has someone in their house that is medically fragile, could their child continue with distant learning?
Yes, there's also a provision in the education code that was passed in June that gives parents the opportunity to self-identify and make that request for their child to receive distance learning, even if the child may not necessarily require it for their own medical condition, but others in the household could. And so that is an allowable request, and schools would be required to honor that request if a parent makes it.
Got it, thank you. If the next question, if my child has regressed during shelter in place, for example, if they have actually gone backwards in their reading ability, or if they are behind in meeting their IEP goals, how will the IEP team measure and address this?
The IEP teams are going to be responsible for updating the present levels of performance and identifying what the impact of shelter in place has been for students' academic and social development. Adjustments can be made to the IEP. Additionally, parents who have their own observations about learning loss can request additional services and supports. And it's also important to note that the child's teacher will also have a lot of opportunity to help address some of these learning loss challenges through small group instruction, maybe some individualized resources, and perhaps even some opportunities for one-to-one or other things, although I know that will be virtually as we start this school year.
Got it. Thank you. How are related services that are push-in, like speech and language or social skills group, going to be implemented during distant learning if it continues?
Most of the ways that distance learning is impacting these services is going to be addressed through technology. Some of the ways that we attempted to do this in the spring that were successful, that we envision could continue, maybe some connections where the therapists are able to push in to the classroom setting, the classroom environment, and using breakout rooms or assisting the teacher with the instruction, the lessons. Additionally, some of those services can be provided individually, again, through the learning management systems or virtually, and also through telehealth or telemedicine models. And then lastly, we recognize that that's not the ideal way for some services to be provided, and that may mean that there could be some additional supports where training is provided to other adults who can assist in the delivery of those supports. So that may mean training to the teacher, it may mean training to paraprofessionals, and offerings of support for parents as well. Not as a replacement for the IEP services, but as an enhancement, given the difficulty of our times.
Wonderful, thank you. And question number 7, we have heard from many parents that during the shelter in place, many things have been delayed or put on hold, such as meetings, services, and assessments, more specifically new requests, or assessments started but not completed. What can parents expect once the districts are open?
There are a few things I think parents can expect. The first is that a number of investments have been made since March to step up in terms of the availability of technology and training for all school personnel. So in that regard, I think some of the things that we didn't think were possible to do virtually in the spring, we have a better handle on how we could do them and do them well. So I think that we will see that schools are discovering new and more and better ways to deliver those services, as well as finding better platforms for delivering them. And therefore, I believe that some of the requirements that maybe would have prohibited those types of meetings from occurring in the spring are no longer barriers. And so I think you'll see that meetings and services and certain types of assessments will be able to be provided, and they'll be provided through technology primarily. However, there will be some limitations. There are some assessments and certain types of assessments that really can only be done effectively in person. And so to that degree, I know that schools are studying alternative types of assessments that may be just as valuable, but do not require the in-person offering. And then lastly, I think that, again, our medical providers may be in a better situation to help enhance or add additional information to our assessment process, as we do know that pediatricians are going to be able to deliver their services in person.
Thank you. That was very insightful. Great. Now we'll pass the next set of questions to my colleague, Mona.
Thank you, Rosa.
Thank you.
Hi, my name is Muna Rad, and I'm also in the education group at Parents Helping Parents. And we have more questions for you, Dr. Dewan. What would happen to a student's IEP if the family wanted to continue distance learning for their child further next year?
So at the point that schools are able to offer in-person instruction and parents still feel more comfortable with distance learning as an option, that will be allowable, and that will be permitted as the current education code is written. And therefore, what I would envision is that there could be a need for some adjustments to the IEP if there are services that specifically require in-person, or if there are supports that the student has described in the IEP that are very specific to a setting. Those adjustments could potentially be made through the IEP process. So some IEPs may need to be adjusted and others may not be as impacted as a result of a parent opting into distance learning.
Great, thank you.
And Mona, if I could just mention, these requirements that I'm describing in education code, I do want to clarify that those requirements apply to all schools. So they apply to the programs that our county office offers. They also apply to traditional public schools and also to charter schools, and any school that is receiving state and federal funding for the delivery of special education services. Those requirements would apply to them. And the announcement that the governor made on Friday about the move to distance learning in counties that have that are on the state's watch list applies to all schools. It applies to charter schools, traditional public schools, and also to private schools. It does not apply to child care centers, preschools, and other kind of student serving programs that are not associated with K-12 education.
Great, thank you very much. This is helpful. So if a student is anxious and traumatized because of the shelter in place, and if it affects their ability to learn, what could a parent do?
I think this question is so key, and to where we are together as community right now. I think many of us are feeling traumatized and anxious. We're grieving and feeling a sense of loss. And I think also a lot of the anxiety is situated around what we don't know. And I think sometimes children also feel the anxiety that we have. So as parents, as community, when we're expressing our anxiety, it does impact the children who are around us. So as parents and community members, I think we can engage our young people in conversations about trauma and anxiety and name the feelings that we're all having and explaining those. I think really listening to our children and giving them a chance to express how they're feeling and helping them learn how to name it and how to talk about it and express it. I think that it worsens the trauma and it worsens the anxiety when we don't have the words that we need or the space or place to actually talk about it. Creating some practices and schedules and routines within your home and within your day and week that help reduce anxiety can also be really helpful. That gives children a sense of safety. They know what to expect. They can gain a sense of control and calmness around what their day will look like. And while that won't take COVID-19 away, it does create a safe environment and a better sense of self for our children, and can help reduce anxiety and feelings of anxiety. I think it's also really key for all of us to teach self-regulation and calming activities. I certainly need them, and I think you know, even as adults, we can model for our children self-regulation and calming. We do have some resources through our Inclusion Collaborative that parents can use with children through our Inclusion Collaborative calming kits. There are also books and topics on this story, and children's books that are on this topic, and engaging in children's literature to help our children talk about anxiety can be helpful, and social stories can also be very helpful. And giving our children positive feedback about how they're handling the situations and how they're engaging in their routines. I think if we can model some self-care as parents and saying some things out loud about what you're thinking and feeling and how you're handling it, that models a response, such as, you know, I feel anxious and nervous, so I'm going to take some time to stop right now and take a few deep breaths. And then saying, okay, now I've had some deep breaths, so I feel a little bit more ready to get started with our assignment or get started with our work. And then as we start that assignment together with our child, saying, you know, we started our assignment, or I started this task, and I feel good that I'm doing something that helps me learn new things. Learning new things is fun. So engaging in conversation and saying things out loud that help give our children the model response and new vocabulary to use in that. Calm safety routines. And again, if you think that these situations are more serious than that, and more serious than you can handle on your own, seeking assistance from healthcare providers, mental health providers, and others. And also, please feel free to call the warm line for assistance and ideas as well. And we'll share that number again at the end.
Wonderful, wonderful. So should parents be proactive and include a plan for shelter in place for the coming year in their IEP?
I do think that is a good idea. I think that we can expect COVID-19 to be with us for a while, and being proactive and having given some thought to and asking the schools about how shelter in place or how distance learning will impact that child's IEP is a really, really good idea, and I would encourage all parents to do that.
Great, thank you. You mentioned some of the resources that Santa Clara County Office of Education has, but what other resources does Santa Clara County Office of Education have that parents should know about?
Well, in addition to the website and the warm line that I mentioned, we do offer some parent groups. And we are not doing those in July, but they will start up again in August. And these are groups where parents can come together and in a facilitated conversation around specific topics and needs and concerns of interest to them. And those will start up again in August, and we'll share that information with parents, helping parents to help get the word out about those.
Thank you. Communication is so critical between school and parent. If a parent feels that they're having an issue with communicating with either their IEP team or their child's school, and we heard this, what suggestions do you have that might help improve communication?
One of the most important things to do right now, I think, is to identify a main point of contact. Given how disruptive shelter in place has been, I think it is challenging and it's unsettling. So one of the main things to do is to ask who should be the main point of contact for you as a parent during distance learning or during shelter in place. And also when making requests, asking the school and whoever the person that you're reaching out to give you a sense of how much time it's going to take for them to get back to you, so that you have a sense of expectation and that they can also understand how urgent your need is. I think that's really important to help set expectations, because none of us really have access to the full range of resources and contacts that we normally would have if we weren't dealing with an emergency. And so those would be two important recommendations. I also think it's really helpful to have other parents or other resources to be a fallback, and know the name of the director of special education in your local school district. The director may not be the first point of contact, and probably not the most appropriate first point of contact, but it is important. Directors of special education really care about the children and families that are within their district and under their purview, and often they can leverage points of contact and create ways for information to flow that perhaps a local teacher may not have the capacity to do during an emergency.
This is so helpful. Thank you. Finally, but very importantly, how can parents help? How can they contribute to the success of the coming school year?
So I think that this coming school year is going to be very challenging, and perhaps some disappointments as well, as we continue to grieve what we used to know in terms of education. I think that parents can support each other and support the school personnel and coming together around their children and their children's needs. I think during an emergency, it's really important to stay informed. Information is changing very rapidly. And one of the best ways that parents can help is by staying informed and participating when there is a local town hall or an opportunity for parents. There are also a number of community resources that go beyond the schools, and being informed about what's available in your community can also be very helpful. So for example, a number of our communities have family resource centers, and the family resource centers are providing supplies and materials, have information, access to local library books, and a whole host of other resources. And so that can be a way for parents to really contribute to the success of the coming school year. Another is to really follow the guidance from the public health department. The more that each and every one of us follow the guidance, the better chance we have of being able to return to in-person instruction sooner. And ensuring that our children stay on track with their health checks, their dental visits, all of their medical care, and that they stay healthy is going to also be really important, especially as we think about going into a typical fall where we may, in addition to COVID-19, have the flu and other illnesses that we always deal with. And so the more that we can all come together around health and wellness, the better chance we have as a community to have a successful school year. I do know, there are a lot of worries about distance learning and the quality of that. And so another potential way that we can come together and support is giving our schools and giving our teachers another chance, a fresh start with distance learning, keeping in mind that when we transitioned to distance learning in the spring, we went, overnight from in-person. And now there are more requirements and a lot of expectations. So also give teachers feedback and give parent or principals feedback on how your distance learning experience is going.
Wonderful. Thank you so much. Thank you so much, Dr. Dewan, for this important and informative conversation. You helped answer and clarify many of the questions that our families have during this unusual time in relation to their children's education. And you helped us see the work and the planning that's put forth by you and everyone in this county and your team to prepare for our students to re-enter in the fall. Thank you as well to the many attendees who spent this hour with us. Just so you know, we will be sharing the questions posed in the chat box without users' names or with users' names with the Santa Clara County Office of Education, if that's what you want. It will help them understand better the concerns of the parents and tailor future communication with parents. For those of you who have additional questions, please, like Dr. Dewan says, please contact your local school district or the Santa Clara County Office of Education or our education staff at Parents Helping Parents by calling us at 408-727-5775 or emailing us at info@php.com. I wanted to remind you that Parents Helping Parents provides information, resources, and support to families of children and adults with challenges and special needs and the professionals who work with them. Do consider checking upcoming events and trainings on our website calendar at php.com. And please take a minute to answer the quick poll that we have on your screen. It will help us do better and it will help us understand how helpful this was. Thank you.